Okay, I'm gonna start by scanning my room, counters, scanning the floor, my patient. I am scanning my instruments, the rest of the table, the floor, and I'm gonna start. Can you see me and her? Okay. My name is Latasha Carruthers. I'm F&P student for the University of Memphis. I will be performing a head-to-toe assessment on my patient Latoya. Today is January the 18th, 2023, and I will start by washing my hands. Throughout this entire assessment, we're going to be assessing the skin of the face, the neck, um, the head, the posterior, anterior chest, the abdomen, and the upper and the lower extremities. We are looking at color, we're looking at texture, we're looking turgor, we're looking at moisture, any edema, any levi, any bruising, scarring, any lesions, edema, and none is noted throughout. Next, we're going to look at the patient's head, looking at the size, the symmetry, and making sure the midline it is. Next, we're going to look at the patient's hair, head, and scalp. We're looking at hair texture, hair color, any depressions, any infestations, any edema. There's none present. Next, we're going to palpate the temporal arteries, any tenderness. No. Okay. Next, we will start by assessing the lymph nodes of the head and neck. We'll start with the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, and the submental. Any tenderness noted? No. Okay. Next, we will go to the ears. And with the ears, we are looking at the shape. We're looking at making sure they're symmetric, and they are. We're going to be assessing the auditory canal and the tympanic membrane. We are looking for any drainage, any redness. The tympanic membrane is gray, pearly, clear, no drainage noted. We'll assess it from both sides. Okay. Next, we will perform the whisper test. We will ask the patient to occlude one ear and tell me what I say. ABC. Occlude the other ear, tell me what I say. 1, 2, 3. Next, we will perform the Weber test, testing for lateralization. Tell me if you can hear it in both ears. Yes. Okay. Next, we will test the Renee test. Tell me, can you hear it? Yes. Hear it? Yeah. Okay. Can you hear it? Yes. Can you hear it? Yes. Okay, that test determines that air conduction is greater than bone conduction. We're going to test for TMJ. Can you say ah? No crepitus, no supplication is noted. Also, we're going to test cranial nerve number 5. We're going to assess the masseter muscle. Can you clench your jaw? Okay, no crepitus noted. We're going to also do light touch. Can you close your eyes and tell me where I touch you? Forehead, jaw, chin, nose. Okay. Next, we'll assess cranial nerve number 7. It's for facial symmetry. I'll tell the patient to smile, to frown, to puck out your cheeks, to pucker your lips, and raise your eyebrows. Okay. That's easy. Okay. I'm going to also go ahead and do cranial nerve number 11. I'm going to ask you to shrug your shoulders against it. Okay, that's cranial nerve number 11. That's intact. Okay, next we will go to the eyes, and we're looking at both of them. We are going to look at the sclera. It is white. We're going to look at the conjunctiva, which is pink and moist. We're also going to look at the eyebrows, the lashes, and the papilla fisters. They're intact. We're going to assess the frontal and the maxillary sinuses. Any tenderness?
No.
Okay. Next, we're going to assess cranial nerve number 2. That is the Snellen chart. I'm going to ask the patient to occlude one eye. Read the lowest line.
L-M-N-O-B.
Okay. Occlude the other eye. Read the lowest line.
L-O-M-O-B.
Okay. With both eyes, read the lowest line you can read.
L-O-M-O-B.
Okay. With cranial nerve number 2, the patient has 20/20 vision. Next, I'm going to assess cranial nerve number 3, and I am looking for pupillary response to light. The pupils constrict. Next, I will assess cranial nerve number 3, 4, and 6, assessing the extraocular movements, conjugal gaze. You will look at my pen and just follow with your eyes. Okay, patient is able to do that. Next, I will ask the patient to, next I will go to the patient's nose, making sure that it is midline, and it is. I will ask the patient to occlude one side of your nose. Okay, breathe in and out, checking for patency. Occlude the other side of the nose, breathe in and out, checking for patency. Okay, and it is. I'm gonna also do cranial nerve. Close your eyes. Occlude one side of your nose. Tell me what you smell.
Cinnamon.
Okay. Occlude the other side of your nose. Tell me what you smell.
Alcohol.
Okay. Okay. Next, I'm going to look in your eyes, looking at your internal structures and looking at the red reflex. Okay, red reflex, noted. I am going to go ahead and do sternosia. Close your eyes and tell me what I place in your hand.
A key.
Okay. Close your other eyes and tell me what I place in your hand.
A paperclip.
Okay. Keep your eyes closed. Hold out your hand. Tell me graphesthesia. Tell me what I write in your hand.
M.
Okay. And what shape I write.
Triangle.
Okay. Open your eyes. Okay. You can open your eyes. Next, we're going to go to the posterior chest. I'm going to turn you around. Okay, on the posterior chest, we're looking for any deformities, any abnormal breathing, such as tripod positioning, nasal flaring, retractions. There are none. Any cyanosis, there are none. Next, we're going to test for tactile firmness. I'm going to tell you to take a deep breath, let it out, okay? Then I'm going to check for, I'm going to get you to say 99,
99.
99,
99.
99.
99.
Okay, there are no heaves or anything. Next, I'm going to percuss over the lung fields. Okay, timpani is heard throughout. Next, I'm going to listen to the lung fields. Take a deep breath above the scapula, let it out. Okay. Next, I'm going to go ahead and palpate for CVA tenderness. Any tenderness noted?
No.
Okay. I'm going to turn you around to the front. Wait, sit down for a minute. I'm going to also listen to egophony. I'm gonna get you to say E,
E, E, E, E, E, E, E, E.
Bronchophony, say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Whisper pectoralis, say, I'm gonna whisper it to you. 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 1. 1, 2, 3. 1, 2, 3.
Okay, we're gonna turn around to the front. I'm going to, in the front, I'm going to look at the anterior chest, making sure there's no heaves, no respiratory distress, no use of no accessory muscles, no cyanosis. I'm going to listen to the, ask the patient to take a deep breath, let it out. I'm going to say 99,
99,
99,
99,
99.
99.
Okay, I'm going to listen to the anterior lung fields. Take a deep breath. Okay, I'm going to go back to the neck. I'm going to look at the trachea, making sure that it is midline. It is. I'm going to go behind the patient and assess for the thyroid. Take a swallow. Okay, do it again. Okay. Next, I'm going to palpate the carotid arteries. And then I'm going to listen for any bruise. Okay, next I'm going to go to the heart. I'm going to listen to all the heart tones with the diaphragm and the bell of my stethoscope. We're going to start with the aortic, pulmonic, Erb's point, the tricuspid, and the mitral. We're going to listen to the PMI, which is the pulse of maximum impulse at the fifth intercostal space, fifth clavicular line. We'll listen for a full minute for the apical pulse, for pulse and rate. We're going to listen again with the bell, pulmonic, aortic, pulmonic, Erb's point, tricuspid, and mitral. Then I'm going to have my patient to lie down. Okay, the patient head will be at a 30-45 degree angle. We're looking for any jugular vein distension, and there is none. We're also assessing the chest for the anterior chest for any lifts or heaves. Looking for any respiratory distress. It is none. We're going to also listen to the anterior chest wall, the heart sounds again. We're going to listen to the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. While we have the patient lying down, for demonstration purposes, we'll listen, look above the clothes. Usually we'll be under the clothes. We're going to look at her abdomen, making sure it is round, non-distended, symmetric. We're going to listen to the arteries. We're going to start with the aorta, the renal, the iliac, and the femoral arteries. We're going to listen to the bowel sounds in all four quads. We're going to percuss in all four quads. We're going to do touch in all four quads. We're going to assess for the liver and the spleen. Okay, while the patient can sit up. We're gonna also go back to the mouth. We're looking at, with the mouth, we're looking at the lips. We're looking at the buccal mucosa. We're looking at the tonsils, the salivary ducts. We're looking at the roof of the mouth, the tongue of the floor. We're looking at the tonsils, and she has none. We're gonna assess cranial nerve number 9 and 10. We're gonna ask the patient to stick out her tongue, and we're making sure the uvula rises and falls. We're gonna assess cranial nerve number 12. We're gonna ask the patient to stick out her tongue and move from side to side, okay? No fasciculations, okay? We're going to assess like touch of the upper and lower extremities. Close your eyes and tell me where I'm touching you at.
Elbow, arm, fingers, feet, foot, side of the foot, ankles, knees.
Okay. Next, we're going to assess radial pulses bilaterally. Next, we're going to assess capillary refills. They are less than 3 seconds. We're looking at the skin. We're looking at the joints of the fingers, the hands, the elbows, the shoulders. For the lower extremities, we're going to assess capillary refill. Also, we're looking at the skin of the upper and lower extremities, the feet, the ankles, the knees, the hips. No redness, no bruising, scarring, anything noted. We're going to assess the dorsalis pedis pulsus, posterior tibialis. We're going to do deep tendon reflexes. We're going to do the radial, the brachial, the tricuspid, the patellar, the Achilles, and then the Babinski. We're going to do it on this side also, the radial, the brachial, the tricuspid, the patellar, the Achilles, and then the Babinski. Okay. Next, we're going to do the musculoskeletal of the upper. We're going to do range of motion with the cervical spine. You're going to flex, extend, hyperextend. You're going to side to side, and then rotation. Okay. We're going to do the fingers. We're going to flex, extend, ulnar deviation, ulnar adduct, and then we're going to rotation. We're going to do the wrist. You're going to do hand grips. That's 5 out of 5. Hold your arms up like this. Try to pull against me and then push against me. Okay. We're going to do foot pushes. Up, push up, then push down against my hand. Okay. We're going to do the arms. We're going to flex. We're going to extend and then hyperextend. Okay. Next, we're going to stand up. We're going to do the knees. We're going to flex, extend, and hyperextend. Okay. Next, we're going to do your toes. Kind of sit down. I'm sorry. Flex, extend, in, out, rotation. We're going to do your ankles, plantar, up, in, out, and rotation. Okay. We're going to stand up. We're going to do the Romberg test. Close your eyes. No wavering. I'm going to ask you to walk to the window. Okay, and turn around and walk back and heel to toe. Okay, I'm gonna ask you to hop on one leg. Okay, and same hop on this leg. Okay, we're gonna turn around. We're gonna look at her back. We're checking for any scoliosis, being forward. no curvature of spine or anything. And that concludes our presentation.